Hi, my name is Garrett Flax, and this is my rough draft for the media clip project in educating exceptional students. Now what you're seeing here is a mostly finished presentation, created it using Prezi, and I'm recording this with Screencast-O-Matic. Um, what will be added or changed in this presentation is mostly citation and just light editing touches. About half, three-quarters of this is cited accurately and set up the way that I would like it. So no big changes should be observed between now and the final draft, other than notes of reference to be accurate and academic. So I went the route of attention deficit myths and facts. And from, of course, a wide-ranging field of misunderstandings and thoughts and opinions on attention deficit, I took three myths that I picked because I felt they were representative of a very wide group of misunderstandings about attention deficit, and that they're common enough that even I, in my youth and inexperience, even I've heard of these things. So they aren't too oddball or out of the way. So let's go ahead and get started. Myth 1, attention deficit is not a legitimate disease. It's just an excuse that's used to explain difficult children or irresponsible adults. Definitely heard this from an unfortunately large number of people. But as I understand it, most of the population would disagree with this myth. See, the thinking is that it's poor parenting or bad public schools that produce these symptoms of what we call attention deficit symptoms. And if we could just parent better, or we had better public schools, we wouldn't be seeing these things. So it's not really a disease. But like I said, it's not what most of the population believes. That's an older belief, a myth that's been around for a while and is starting to slowly work its way out. But things take time. I've still heard that recently. So just some numbers on what percent of the population has attention deficit. CDC, which is a government institution, puts the number at about 8% of children, and the APA, which is the American Psychiatric Association, puts the number at about 5%. Both very reputable sources that can certainly be trusted, and the 3% difference between the two really doesn't matter that much when you think of the huge numbers that they're looking at here. This is for the entire population in the United States of children. So anyways, that's just a simple response I have here from Dr. Inkler. He's in charge of school psychology here at Fort Hays State University. I went and interviewed him and got his thoughts on all three of these myths, and he certainly agreed that this myth need be disproved based on his experiences. And I believe he was a school psychologist for 3 years, and he is currently working on his PhD. He need only defend his thesis and he'll have a PhD in school psychology. He believes that ADHD is largely real. It can sometimes be difficult to get people to believe it, and that's unfortunate, but it happens because it's not easy to diagnose attention deficit in any situation. And another sort of facet of this myth is that we don't know what causes ADHD. Not exactly. And so some people would say, well, you don't know what the cause is. It doesn't exist. Well, there's a lot of diseases and disorders that until recently, until modern medicine, we didn't understand what their cause was, but we still understood that they were diseases and still believed that they exist. So I don't think that's a very strong argument, but it is an argument that's made. The DSM, which is the Diagnostic Statistic Manual, it's made by the APA, which I mentioned previously, is a reference book, and its research, or the research that went into making that book, states that there may be a genetic factor to it. They looked at family trees. It appears that it is sometimes passed on to children, adults that have attention deficit passed on to their children, but not always. We can't say it's entirely a genetic factor. Brain shape and size, volume differences, those things have been looked at from every different angle, and the study that I mentioned here, they found that difference between boys who had attention deficit and boys who didn't. There was a clear difference, but it wasn't found between girls. So it's really hard to 100% say what the cause of attention deficit is. We know that there is a cause, we just haven't fine-tuned what it is yet. So the second myth we move on to is that attention deficit is outgrown. And this is probably the most common of the three myths. I've heard this more than any of the rest. And it's unfortunate that that's not the typical case. Usually, attention deficit symptoms are not outgrown, they just change. And it's important to understand that attention deficit can be grouped, or the symptoms can be grouped into at least two categories: the physical hyperactive symptoms that we see, and the mental inattention and restlessness, those things that we don't see, but the person still feels just as strongly. And the reason that I think this myth was created, or what it stems from, is these physical hyperactive symptoms, they change. They're much more noticeable in children, but adults and teens can better cope with those symptoms. Doesn't mean they go away, they take a different form. Instead of running around the classroom, maybe a student now as a teenager in high school taps his foot all the time. It's still present, but it appears less severe, and we can't see it from the outside looking in as well. So you get the misunderstanding that it doesn't exist anymore. And again, this is another quote from the DSM. Their research backs up that a pretty substantial portion of people who as children have attention deficit still have it as adults. So I substantiate that adults with attention deficit do still suffer from it, and it can cause a wide variety of difficulties and challenges in their adult life. This here is a rather long quote, but the short of it is, it's a testimony from a man named John Warner, who's now in his late 60s, and was diagnosed with adult ADHD at this point in his life, but looking back on his elementary and high school and then all of his professional career, he's had clear symptoms of attention deficit all his life, but attention deficit wasn't known this far back, and it wasn't realized. And so I just thought it was a really good, really straightforward testimony about the reality of attention deficit and that it doesn't go away. And this here again, Dr. Engler, who, when I interviewed him, what he said with this lined up perfectly with the stuff I'd been finding in research, that there are different types of attention deficit, and the reason that this outgrowing myth is sort of originated is that these symptoms change. These hyperactive symptoms turn into things that we can't see as well, but they're still there. And the symptoms of mental inattention, those don't ever go away. So it's good to see those two things match up. And he felt pretty strongly about that one. Children don't outgrow it, not often. The final myth deals with the treatment of attention deficit. Now, I've heard that these medications aren't worth using, that they aren't always effective, that they can sometimes be unsafe, and that's false. This kid certainly thinks it's false. So I think there's just a lot of confusion in the way that these drugs work. They're often referred to as stimulants or psychotropics. It covers a very wide range of things like Adderall, Ritalin. Those are just some of the more common names that even I knew without having to look up. It's generally believed that for persons, especially those who show the hyperactive symptoms, and note that in attention deficit, it's often true that a person is a combined type. That's something Dr. Engler explained to me. You don't just have hyperactive symptoms or just have inattention mental symptoms. It's usually a combination of the two. And medication can do a lot to alleviate the symptoms of hyperactivity and sometimes the symptoms of mental inattention. But that's most symptoms in most of the population. What I mentioned here is that they've been around for quite some time. These stimulants are nothing new. They've been studied, they've been researched. There isn't a matter of a lack of safety, I think, that we should be considering at this point. There are side effects to every prescription drug we've ever made in the history of mankind. These psychotropics and psychostimulants are no different, and that's unfortunate that they sometimes have side effects, but it's something that we have to put into perspective of all medications and all treatments. So most of what I read, they gave an effectiveness percentage. Most of the literature that I looked at, they said in either 70 to 80% of the population or 80 to 90% of the population of patients who have attention deficit and take medication, these are effective in. And that's a pretty good number for just about any medication you look at. If it's got an 80 to 90% success rate, that's pretty impressive. It's not bad. Um, and one other kind of oddball myth I've heard that's connected to this is that taking these medications increases the risk of substance abuse down the road or has long-term effects, and the data just doesn't back that up. Found several studies that said there just isn't any evidence. They've interviewed people down the road that have been taking these medications for a long time, and it just doesn't happen. It just doesn't work that way. If someone suffers from substance abuse and they happen to be taking these medications as well, that's simply a matter of coincidence. There isn't any correlation between the two. Now, there are alternatives to medication. Most commonly, you'll hear these things referred to as behavioral treatments, and they're really similar to what we already talked about in this class called behavioral interventions. And here it lists the 4 principal steps to a behavioral treatment. I found this in some of my literature, and it almost exactly lines up with what you would do with a formal behavioral assessment, and then with behavioral interventions about clearly assessing what behaviors you want to change and what actions you're going to take to do that. Evaluation in the end of how well this intervention worked. What can we change? Do we need to change it or throw it out? So a lot of correlation between what is referred to as a behavioral treatment for attention deficit and what we just broadly refer to as behavioral interventions for children in the classroom. And the combined treatment, actually using medication and these behavioral treatments to make students more aware of the behaviors they're expressing, and medication that can help to suppress some symptoms that they have less control over. The combination of medication and behavioral treatment seems to be really effective. Dr. Engler definitely backed that up. He said that is almost always the best way to go about it, not one or the other, but both together. And so I found some data on that, looked at what that effectiveness was, and it clearly shows that when treatments are used in a combined manner, that is better than either medication or behavioral treatment on their own. And that wraps up my rough draft. If there is anything I have to change, other than the citations that I mentioned at the beginning, it might be the length, because I think I ran a little bit over time. I know part of that's the explanation here at the end and the explanation at the beginning. But with as much time and work as it took me to put this together, I am cautious to start taking things out and removing information that took me hours to find. So we'll just have to see how that goes. But these are my sources and my works cited. Like I said, this will probably be added to a little bit, and you'll see more citations throughout the course of the presentation to make it accurate and more academically acceptable. I've got those. I just don't have them in the presentation yet. So that's all I got. This is my rough draft. Garrett Flax, Educating Exceptional Students Media Clip Assignment, and I am out.